healthcare feels like something that is constantly talked about at the moment, and what I found kind of an interesting learning experience is trying to separate the hype from the reality. This is the definition that's used in the government's industrial strategy. So they define AI as technologies with the ability to perform tasks that would otherwise require human intelligence, such as visual perception, speech recognition and language translation. So, for example, machine learning, which is something that a lot of the conversation focuses around, and it's about how you essentially build an artificial neural network. So it's inspired by how the brain works, where you can train it to analyse information by training it on different data sets. Natural language processing is another thing that is often talked about. So, for example, analysing speech of a doctor and converting that into text. Image recognition is really important for medical imaging and pathology, and then chatbots and things like that. How is AI used in healthcare? There are kind of 5 broad types. So the first category being process optimization, which is things like logistics and procurement and HR. Preclinical research, so from a broad Cancer Research UK perspective, this is something we're quite interested in exploring. So for example, in drug discovery, crunching huge amounts of genomic data. Clinical pathways, which is, for example, using AI in parts of diagnostics or understanding a patient's prognosis. It's things like, using AI to analyse a breast screening image, for example. And then patient-facing applications, which I think are really fascinating. So chatbots, personalised health advice using wearables, population-level applications. So this is about, big data sets and analysing larger trends. In terms of what I've come across, the most progress has been made in image-related tasks in clinical pathways, so radiology and pathology being the 2 main ones. What's really important to say up front is that I think there is a lot of hype out there and a lot of bold claims made about, we won't need radiologists in the future because we'll just plug it into an AI. The consensus I seem to have heard so far is it seems to be more about augmenting tasks or automating part of someone's workflow rather than wholesale replacing people. I think there's been a lot of attention given to using AI to determine, much broader parts of patient pathways. While I think everyone's very excited about this, none of this stuff is really immediate. The other thing just to be aware of is that AI is to some extent already pretty well embedded in clinical pathways. So aspects already of radiotherapy that's fully automated and is AI based, but that's just kind of how it's worked. It's not been a big hype thing like there has been for imaging. It's just been a kind of natural progression of the software. In the screening space, breast radiology is a really interesting area, and there's some large-scale trials going on at the moment which are really exciting. Where it is more applicable is to tasks which are binary, which are repetitive, and which are underpinned by large data sets. So screening is a pretty obvious example of that, huge data sets. To realise potential, there are a few things we need. This relies on really consistently high quality data. So, you have to have good quality data for the decision made by AI to be trustworthy. And while cancer data is often heralded, even when we do what seem to be relatively basic analysis of treatment data, there's a huge amount of cleaning that has to go into that. Interoperability is also really important. So one of the screening testbeds at the moment, they all have a consortium with all the IT, they've all got the same IT system, they've got a joint agreement, and that's why it's working well. But that's not the case for the rest of the country. Frameworks for adoption and diffusion. So do we have the right regulatory pathway for AI? Do we have the right ways of getting from a testbed to nationwide equitable access? Not at the moment. Do we have a system that works for patients? How do we build that? Also, workforce. So the Topol review, which was out recently, says that within 20 years, 90% of all jobs in the NHS will require some element of digital skills. But to get to the point where 90% of staff in the NHS feel comfortable using this stuff, there needs to be a lot of training throughout that, including ethics. In summary, AI definitely won't replace all doctors, and it definitely won't replace the value of a good doctor-patient relationship and treatment decision-making discussion, but it could have huge potential in improving patient care, improving patient experience, and in efficiency savings as well.